All right, it's 6:35, so we will get started. So welcome again, everyone, to our almost monthly. We're close to having that many presentations now. SUD community workshops here at OCHN. My name is Anna Jessup, and I'm one of the SUD clinical analysts and Women's Specialty Services Coordinator. And I oversee and help coordinate our community workshops here that we try to hold monthly on topics related to our SUD community environment. This month's topic is safely dispose of unwanted and expired medicines. Here to present with us is Nadli Arabo from the Oakland County Health Department. So we're excited to have one of our prevention partners here to this month to help present today. Just a quick few side notes before I hand it over and let her take over, and I will be quiet on this end until the very end. Again, make sure that throughout the presentation you are muted, that we are not hearing background noise or things maybe you don't want us to hear and things of that nature throughout. Make sure you don't have to, as I make sure you don't have to have your cameras on, but it's always encouraged so we can still feel more together while we are having this training or workshop today. Feel free to, again, place your name, organization, and role if you feel comfortable in the chat so we do know who is here with us today in case we cannot see your face. And we know our audience, we know it's diverse, and we always have our few people that, and there's more than few, I should say, that are reoccurring participants. So we know we have a variety of counselors, probation officers, community members, and things of that nature that are here. So we're so excited to have you all here for July. If you are here for CEs or CEUs, I should say, 1.5 MCBAP related, this is a related topic, are available today. Make sure you are here the whole time. You have to have the whole attendance for the certificate as well as at the end completing the evaluation. There is going to be 2 evaluations today. The health department does have their own related to the type of education that they provide. They have to have their own for grants and things of that nature. So please make sure that you fill out both certificates. So just think because you think we did one for the eval or for certificate and things of that nature. So at the very end, we will give out both of those evaluations and then stay on to make sure if there's any problems with it or things of that nature. For OCHN's evaluation, it is open till noon the next day. So if there is some problems tonight and it's 8 o'clock and you're like, you know what, I don't have the energy to do this anymore, you will have time tomorrow morning to complete it. Please make sure that you allow 7 to 10 business days, and make sure to emphasize business days to receive your certificate by the email that you provide, as our training team is the one that sends those out individually to each person who attended and completed an evaluation. I believe that is everything I need to go over for house rules. So with that being said, I'm going to turn off my microphone and hand it over. We're going to get this workshop started for this month. Everyone, welcome Natalie.
Thank you, Anna. Thank you for the warm welcome. Once again, my name is Nadli Arabo. I am a health educator with the Oakland County Health Division, and today's presentation is on prescription drug disposal, and we also offer technical support. So we'll be doing that today. Just a brief overview of our agenda. We're going to cover opioids very briefly, the purpose of this program, what my role is as a technical support representative. I'll offer you some resources and some services. We'll have a quick Q&A session. And then, as mentioned, we do have a post survey that we do appreciate that you would complete. So very briefly, what is an opioid? There are 3 different types of opioids. There's natural opioids, so those are your morphine and your codeines. And then we also have semi-synthetic opioids, so those are the ones you'll receive from a pharmacy. So something like hydrocodone, oxycodone, Norco, Vicodin, Percocet, heroin. Heroin is not received from a pharmacy, but hydrocodone, oxycodone is. We also have synthetics, so those are your methadone and your fentanyls. So just a key point, in Oakland County, synthetic opioid involved deaths have increased. Between 2020 and 2021, there was an increase of 120% in synthetic related opioid deaths, which is almost an additional 100 deaths during that year. So currently we are having an opioid crisis. We are seeing about 187 people die from an opioid-related overdose every day. Now, this is throughout the entire U.S. This number is a little outdated. I would say it's about a year or two outdated. We're seeing the numbers closer to 200 opioid-related deaths daily in the US. And approximately 80% of the people who are misusing heroin have first misused a prescription drug opioid. Now, approximately 3 million of these people in the US are struggling with an addiction to an opioid. An estimated 1.1 million of those 3 million are addicted to heroin. And as of 2020, the opioid epidemic did cost the US about $1.5 trillion. Now, this is 4 years later. We're still waiting for the statistics to come out so we can see how much the opioid epidemic has truly cost the US and what we're also doing to support it. Now, the crisis in Oakland County, between 2011 to 21, there was a 265% increase in all drug overdose deaths. In just Oakland County, between 2019 and 21, we saw that there was a 68% increase in all drug overdose related deaths. We're seeing that in October of 21 to September of 22, Black individuals in Oakland County died from a drug overdose at a rate of 1.7 times the rate for white individuals. And during that same time span, we're seeing that men in Oakland County are dying 3 times the rate as women in Oakland County. Now, also between October of 21 to September of 22, the disparity is even greater with ER visits. We're seeing that Black individuals in Oakland County visited the ER for treatment related to drug overdose twice the rate as white individuals. However, we're seeing that with men and women related to ER drug, overdose related issues, that we're seeing that their rate was very much the same during that same time span. Now, drug overdoses by gender. We're seeing that in about, I want to say it was 2016, we're seeing that males are overdosing more than we're seeing that the females. We're not exactly sure what happened in 2016 that led to this overdose, but we are seeing that the rate was 3 times higher than it was for women. Now, during this time span, we only tested for the 2 genders, male and female. We did not get into any of the other genders at this time, so we just wanted to make that a key note. Now, overall drug overdose related deaths, this chart is really showing how the rates have really increased. Now, in 2020, we're seeing that it is shooting up. We are attributing that to the pandemic and how it has related to drug overdose deaths. A lot of research has shown and supported that it is related to the pandemic. We just haven't been able to really pinpoint it, but from what we're seeing is that in 2020 pandemic hit and we're seeing an increase in drug overdose deaths. Now, when we're comparing it by race, this is that chart that's showing that Black individuals in Oakland County are overdosing at a rate of 1.7 times the rate for white individuals. This chart is still, between October of 21 to September of 22. We're trying to show that visual to show that it is almost 2 times more than white individuals. Now, opioids are leading to other health problems. This issue has become a public health crisis with devastating consequences, including increases in opioid misuse and related overdoses, as well as rising in incidence of neonatal abstinence syndrome due to opioid use and misuse during pregnancy. The increase in injection drugs has also contributed to the spread of infectious diseases like HIV. We're also seeing an increase in Hep C. Now, related to comorbidity, it is a common medical condition associated with opioid use disorder, especially with viral opioid use viral infections, particularly amongst those who are sharing by injection. Now, related to mental health, we're seeing individuals are being diagnosed with those being diagnosed with an opioid use disorder are significantly more likely to be diagnosed with a serious mental illness or other mental health illnesses. And they're also co-occurring is what we've noticed. So an individual who does have an opioid use disorder, they are at a higher risk of developing a substance use disorder. We've seen that those two are going hand in hand. So I just want to talk about what Oakland County is currently doing about this crisis and how we're addressing it. We have a couple of programs that we have out in the community. The first one I want to mention is Catch My Breath. It is a vaping prevention program that we do in grades 5 through 12. Now, this is a program that we do throughout the entire county from, I've done it in middle schools, high schools, private schools, elementary school. We do it everywhere from Rochester Hills to Hazel Park, Pontiac. We're all over the county. We've seen that there is a need everywhere. What we try to do is we talk to the kids. It is 4 lessons with Catch My Breath, and we talk to them and we give them the essential skills that they need to make the proper decisions in order to prevent youth nicotine use, and also help them develop decision-making skills, communication strategies, and coping mechanisms. Now, related to that program, we have one for adults. It is called Vape 101. It is about a 1-hour session where we talk to adults in the community, those primarily working with students or the youth. Pretty much anyone can attend who wants to learn more about this vaping epidemic, and to get really the resources on how to make that change and address the youth that are currently vaping. Once again, we do this all throughout the county. We've done it in libraries. I know we have a couple of sessions that will be webinars next month. So if you are interested, please contact us. Another program that we do in the schools more related to drugs is our Michigan Model for Health, Alcohol, Tobacco, and Other Drug component. But we also have our social emotional health component. Those are only for grades 4th and 5th grade, where we do, is very similar to Catch My Breath. We go into the schools and we talk to kids about alcohol, tobacco, other drugs, really help them get the tools that they need to have a successful future, and to make the decisions that are the best for them. But we also have our social emotional health component where we help them, navigate the challenges in life, make their informed decisions, and really build positive relationships. Now, we do have our prescription take back program, which is pretty much what this is, where we talk to the community. We talk to you guys about how to properly dispose of expired and unused medications, and then some locations that we have in the all throughout the county. Now, throughout the county, we also have Narcan. Narcan is a medication that reverses an opioid overdose up to 30 to 90 minutes in the body. It is over the counter. Now, only the nasal spray version is over the counter. The injectable version, as well as the pre-filled syringe, is not over the counter. That one is strictly for EMS and hospital use only. However, Narcan is over the counter. It's a nasal spray. If you are in need of, obtaining some, we have a Narcan resource where you can just go on our website and find out where all of our Narcan stations are throughout Oakland County. Back in the day, we used to have newspaper stands. So now, if you still remember those are now throughout the county, but they're filled with Narcan, they're filled with Deterra bags, fentanyl test strips, they're filled with all this very important resources, and you're welcome to take as many as you need. If you do go to a pharmacy to obtain Narcan, they will charge you $150. I know this, I used to work in a pharmacy. I would try to charge you $150. So go to one of the Narcan stations, it's free there. Now, just to touch base, our Narcan kits as of 2023, so as of July last year, we dispensed about 2,600 Narcan kits. Now, it has taken us a minute to update this data, but we will have it updated very shortly. It's only a year old now, but 752 of those Narcan kits were from our clinic. and then 18 of them were from our vending machine. So those are those newspaper stands throughout the county that you will see in various locations. Just go on our map and you can find one closest to you. Now, this is a very important statistic I do want to mention. Now, since July of 2023, we had 188 reported rescues, and that was about one life saved per day. So it is important. It is vital. There is a use for these Narcan kits, and we are seeing them being used appropriately, and we really encourage it. We encourage everyone to have one, on them at all times. Now, when we offer our technical support on how to properly dispose of medications, we have several ways you can communicate with us. Over the phone, you're always welcome to give me a call. If you want to leave me a message, you can do that. I'll put my number on the next slide. You'll see it. You can jot it down. You're also able to schedule a virtual meeting if you want to do something like this over Zoom or Teams. We can always set something up. Now, we can always provide you with resources on where to drop off medications and what types of medications you have, where you can drop those off. We've had questions about something as simple as pills and tablets all the way to inhalers, insulin, anything of that nature. We can always find a resource for you on where to properly dispose of it. We are currently updating our list of drop-off sites where they take back tablets and pills. So we should have an update in the upcoming month or two on our website with the final locations listed for Oakland County. Now, once again, you can always give me a call. My number is the first one listed. Give me a call with any questions you have. We can happily answer it. You can leave me a voicemail. Just give me a day or two to respond. I promise you I will. My parents leave me voicemails all the time, so I know how to use my voicemail machine. But yeah, I will respond back to you. I'll answer any question that you have, and I'll definitely try to get you the resource that you need. So the reason we do this is because we are trying to remove medications, unwanted medications at home, especially expired medications. When there's medications at home, we never know who can come and grab medications that they may not be prescribed to them or should be in their hands. It could be children, could be pets, could be just someone visiting. We always want to make sure medications are locked up safe and away from children and pets, most importantly, and also our teenagers. So if there are medications at home that you are not using, we'll definitely try to find a place for you to dispose of them. There are some other resources instead of just going to police stations. There are pharmacies that do take them back. I know that Henry Ford is one of them. If you ever walk into one of the Henry Ford pharmacies, they have a blue looking mailbox and you can just drop off medications there. But they also have similar ones at local pharmacies. Walgreens, CVS, Rite Aid is going out of business, so we got to remove them from our list. And then Meijer. They're blue or white or black. They will be labeled on there. What you'll do is you'll go to the pharmacist. You'll let them know that you have some medications you want to dispose of. So what they'll do is they will just take the pills or tablets, which is most of the time what they take back. Some locations do take back needles, syringes, and they'll just drop them in a Ziploc bag. They will remove all of your information and then just toss it in the bins. But if you want to be prepared before you go in, just have the medications, your name removed from the bottles. If you want to bring them in a clear Ziploc bag, you can also do that. Most of the time, you don't have to let them know what the medication is, but if it is a medication that the pharmacy has asked you to bring back for whatever reason, they may ask to see it to verify it, but once the medications go in those bins, no one has access to them except for the pharmacist or the police station, the deputy that typically will work those boxes. And then from there, they are sent out to the DEA and they are destroyed. So depending on that location, how much traffic they get with their drop boxes, they will, dispose of them, as soon as they need. It could be every week or every month. I just saw a question about, do you need to bring it in the original bottle? No, you don't. You can bring it in, like if it's a vitamin D, you can bring it in the vitamin D bottle, or you can bring it in a plastic bag, a Ziploc, clear Ziploc bag. If it's something like a narcotic, sometimes the pharmacies will want to see it if for whatever reason, like let's say if you have an opioid, you're on Vicodin 7.5 and your doctor upped you to 10, they may want to see the 7.5 just before they give you that 10 for insurance purposes to make sure it will be paid through. But most of the time they don't ask to see it. Only reason they would ask to see the Norcos because I worked in a pharmacy and I know that's kind of their rule for that, but otherwise they don't typically ask to see the medication. It's not their business. We do have a short video that will show you on how to properly dispose of medications, just a couple minutes, but it is super informative. So I do know that in the video it mentions that you can flush medications. However, we always strongly advise against flushing medications because there are better ways to dispose of a drug other than flushing. If you do have, like they mentioned in the video, coffee grounds, kitty litter, you can always drop liquids in those. You can drop tablets and they will not be able to be used. There are these bags called doTERRA bags. You can find them in our Narcan stations where it is a bag where you open it and has similar to activated charcoal in there, and you can just put your medications, liquids in there, and it completely deactivates the medication. So if anyone were to try to go into that little bag to try to get the pills out or drink the, solution, it will not work. And you can just throw those out in your regular garbage. We do have them all throughout Oakland County, so you can always pick some up. If you need me to point you in the right direction, please let me know. So properly disposing of sharps and needles, it just depends on your community. We do have sharp boxes, throughout Oakland County, but if you do need help finding a location, please reach out. In the health division, we do have sharps boxes all throughout, so you can just come in and drop off your sharps. We also advise you to go, of course, to your doctor's office and local hospitals. Sometimes they do take them back. When you are disposing of sharps, do not fill the containers more than 2/3 full. Now, if you are, being prescribed needles, if you are let's say a diabetic and you have needles, most of the time, insurances will pay for sharps containers. So Henry Ford is one of those pharmacies where if you have a prescription for insulin and you need needles, of course, with it, they will give you needles for free, and then they can just, some locations will take those needles back. Sometimes you may have to mail them back, and all that information is typically on the Sharps boxes. They're red or yellow. You can sometimes purchase them in pharmacies. So you can just go in, they're about, just depending on the size that you need, $10 to $20, you can purchase them. If that's not an option, you can use glass containers. I know my mother likes to put them in her mason jars and hand them to me to dispose of. So you can always do that. You can always dispose them in glass containers, store them there, and either take them to, your doctor's appointment and just have them dispose of them. Or you can keep them even in old laundry detergent bottles. Also, same thing, make sure they're not more than 2/3 full. And if disposing of them at a medical provider is not an option, you are able to throw them away in the garbage. We just want to express precautions, and to throw them out at a medical provider's office is the best solution. Now, this is something we don't typically think about, but electronic cigarettes, those are devices that should not be thrown in the garbage or where we typically see them on the ground. They should be properly disposed of. They are a hazardous waste. Now, if you would like more information on how to properly dispose of those, Christine Grossman, please jot down her number. You can reach out to her and she will tell you where to properly dispose of electronic cigarettes. We should be treating them very similarly to other household waste items. So how we properly dispose of light bulbs, batteries, anything of that nature, that's how we should be disposing of electronic cigarettes. Now, regarding any of these household waste items, I want to say about twice a year, the county partners up with local cities where residents can just pay a small fee. I think it's like $5 or $10, and you can bring in all the hazardous waste that you have. I think some of them may have limits, some don't, where you can bring in your hazardous waste and they'll properly dispose of it for you. So if you would like more information, once again, if you want to reach out to me, I can put you in connection with Christine, or if you already, know that information, that's great. Just share it with others. Now, once again, hazardous waste items, we also want to properly dispose of those. Electronic cigarettes. Here's her number once again, in case you need it. Now, we do this honestly to, of course, protect the environment, protect others, dispose of medications properly. I know we did stress on the opioid epidemic, and it is super important. We do want to make sure that medications are being used for their proper intended purposes. A little example I always like to mention during my presentation is, so my father had his knees replaced. He's at that age, they got to get new knees. And his medication that he was prescribed for his pain, of course, is Norco. But he was also prescribed an antibiotic to go with it. Now, when you just got your knees replaced, you're typically taking your pain medication. My father is the type of person who does not like to take any pain medication, but he did have his antibiotic because he had a dentist appointment. He had to take that beforehand. So since he is a little bit older, he was mixing up his medications. Now, before his dentist appointment, he was supposed to take 4 antibiotics. And thank God he called me that day and he asked me, do I take these 4 blue pills or do I take 4 of these Norcos? Now, had he mixed up his medications, he would have taken 4 Norcos and overdosed immediately. But thank God he called me. I was able to advise him to take the correct medication. So I always like to mention this example because it is real. It actually happened. He is not someone who has a history of medication abuse. He is just, someone who mixed up his medication. So this can truly happen to anyone regarding opioids. So we always want to stress precaution. I did end up having to dispose of his opioids because I knew he is stubborn and not going to take his pain medication. He's just going to complain. So we just got rid of them for him. But I did keep some Narcan on hand because I kept a few tablets in case he needed them. I kept Narcan on hand, taught my mother how to properly use it. We do have trainings available at the county. If you are looking to learn on how to properly administer Narcan, we can always show you how to do that as well. But I just want to say thank you guys for attending today's presentation. We do have the QR code to our survey if you want to complete it now, or otherwise, if we have some questions, we can definitely address those in the chat.
Anyone have questions about any other regarding medication disposal or any other topics? Like I was even think about e-cigarette disposal. I know many of our residential providers
I didn't
might
either.
see
Thank
something
you.
like that. So, or getting rid of it themselves is something for many of our providers to think about.
I see some comments about doTERRA bags. Yes, so let's see. So we do have doTERRA bags. I'm telling you, they're like a plastic little 5x7. And it already comes with like the active ingredients and you can just drop medications in. They are newer. I mean, I've only seen them the last couple of years. I don't know how long they've fully been around for. But we're really trying to push those because they're honestly so much easier to dispose of medications through that instead of pulling out your old coffee grounds and kitty litter and doing the whole thing. But yes, the PowerPoint is provided. I think OCHN should be sending them out. Yeah, correct.
I think they're asking for the care code. So I just put the health division survey in the chat for you guys.
Perfect.
In case you can't use the QR code right there. That link is not our evaluation chat. I'll give our evaluation chat, our evaluation link. But I will put that very in because we also have another question. Where is the closest place to find a doTERRA bag nearest Ingham County? So near Lansing area.
Near Lansing, the closest would be I want to say it's Holly. I think Holly, yeah, because we're primarily Oakland County. So I know all the locations in Oakland County. For Ingham County, you might have to check with your local health division. But if you are ever near Holly, which I want to say is about like 15, 20 minutes away, they do have some locations there.
Another question. The only first time I said a chair bag was at I think it was the first or second. Oh, now I'm blanking on what the convention was. It's 2018. What was it? Or 19?
I started seeing them more after the pandemic. I wasn't fully aware of them
It was
before.
brand new. It was like in our little goodie bag kind of thing, like because it was a harm reduction. I think it was a harm reduction summit. I think that's what it was called. So it was one of the new things that was introduced during that time. Other questions or comments as well?
If there are no other questions, I'll just formally conclude. This presentation is brought to you by Oakland County Health Division as we've partnered with OCHN. If you ever need anything, please contact us. We're here for you and we're here to address you. So whatever you need, reach out.
Perfect. Thank you. Well, with that said, thank you everyone for attending. I will put our link here. Let me just, that way we didn't get them confused. I didn't want to do it at the same time for our survey as well. Why is it, sorry, for some reason, this is like highlighting and I don't know why it's